Hello, Head Start families. Here's another family development team YouTube video for you. This one's on health insurance coverage and assistance. The following services are offered through Workforce Services. So you can visit their website at jobs.utah.gov or visit your local office. Medicaid. Utah Department of Health Medicaid, who is eligible. Medicaid is a medical program for people who have low income and limited resources. To be eligible for Medicaid, you must meet a program type and meet the rules for Utah residency, income, and citizenship. An individual must qualify each month for continued coverage. The monthly income standard varies between approximately 55% and 133% of the federal poverty level, depending on category. There are many types of medical programs. Further details about eligibility guidelines are available in the Utah Medical Programs Summary. So you can contact a Medicaid eligibility worker if you have questions about qualifying for Medicaid or any medical assistance program. So those are some of the target populations: children under the age of 1, children ages 0 to 5, children ages 6 to 18, a medically needy child, foster care Medicaid, child in subsidized adoption, pregnant woman, medically needy pregnant woman, baby or baby, parent or caretaker, relative Medicaid, family medically needy Medicaid, 12-month transitional Medicaid, individuals with breast or cervical cancer, aged, blind, or disabled, Medicaid work incentive program, spend down program, Medicare cost sharing programs, Medicaid for long-term care and waiver programs, refugee Medicaid, emergency Medicaid, and retroactive coverage. So they cover quite a lot, and there are a variety of programs. Most medical programs allow an applicant to request coverage for medical services for up to 3 months prior to the month in which the person filed the Medicaid application. A person who received medical, dental, or mental health services and subsequently qualifies for Medicaid may return to each provider with a Medicaid identification card for the month in which service was provided. And a provider who has already rendered services may subsequently choose to accept Medicaid as payment in full or refuse to seek Medicaid payment because the patient had not been determined eligible for Medicaid at the time of service. If the provider accepts Medicaid, Medicaid may pay for the service. If the provider refuses Medicaid, the patient is responsible for the charges. The U.S. Federal Poverty Guidelines used to determine financial eligibility for certain federal programs follows the Health and Human Services Poverty Guideline here. So this is the 2009 Poverty Guidelines, and they became in effect in 2019. So for the 48 United States and the District of Columbia, persons in family/household with more than 8 persons, you add 4,420 for each additional person to that listed, following this list up to 8. So for one person, it's 12,490. For 2 people, it's 16,910. For 3 people, it's 21,330. For 4, it's 25,750. For 5, it's 30,170. For 6, it's 34,590. For 7, it's about $39,010. And then 8 people is $43,430. The Children's Health Insurance Program, or CHIP, is a state health insurance plan for children who do not have other insurance. It provides well child exams, immunizations, doctor visits, hospital, emergency care, prescriptions, hearing and eye exams, mental health services, and dental care. Preventative services such as well child visits, immunizations, and dental cleanings do not require a copay. So for more information on that option, call 1-877-KIDS now. That's 1-877-543-7669. Or visit the CHIP website You can also apply online and do a mail-in application, and this is still at the Department of Workforce Services. So what is CHIP exactly? The Children's Health Insurance Program, or CHIP, is the state insurance plan, and it depends on income and family size. Again, working Utah families who do not have other health insurance may qualify for CHIP. So children under the age of 19, not currently covered by health insurance, U.S. citizens, or legal residents. And again, it has a max gross income per month and a max gross income per year. So see that if you'd like. The Medicaid expansion plan, anyone who needs healthcare coverage and believes that they may be eligible for Medicaid is encouraged to apply for coverage. Individuals may submit their applications to the Department of Workforce Services to enroll in Medicaid expansion. Submitting an application for benefits does not guarantee coverage. Individuals may also apply in person at the DWS office or by mail. The phone number for that is 1-866-435-7414 for an application or with questions. So again, the eligibility for this is Utah residents, ages 19 through 64, U.S. citizens or legal residents, and then you must meet the income requirements, which are determined by household size before taxes. And these services that are covered include doctor, hospital, and emergency services, prescriptions, laboratory and x-rays, behavioral health services, including addiction, recovery treatment services, family planning services, maternity care, home health services, preventative and wellness services, chronic disease, management services, and much more. The UP program, again, through DWS and the Department of Health, Utah's premium partnership for health insurance helps make health insurance more affordable for families and individuals. UP helps you pay your monthly health insurance premiums through your employer's health insurance plan or COBRA coverage. It's for adults and children who do not currently have health insurance or enroll in COBRA coverage. It will help you pay your monthly premiums when you enroll in your employer's health insurance plan or COBRA. You or your dependents may qualify for UP based on family size, income, and if your employer's health insurance plan or COBRA coverage meets basic guidelines. If you or your dependents qualify, UP will reimburse you up to $150 per adult and up to $120 per child and family every month. The income guidelines to qualify for UP it includes wages that you and your spouse earn, child support, alimony, Social Security, etc. There are many rules regarding income, and it's hard to remember them all, so just fill out your application to the best of your knowledge, and then UP will contact you if they have any questions, or you can contact the local office at the Department of Workforce Services. If you're wondering when you should get UP, when you and your family are not currently enrolled in your employer-sponsored health insurance, if you've begun a new job, if you're eligible for COBRA, if you already enrolled in a COBRA coverage, if you have health insurance offered at work and are not yet enrolled, you must apply for UP before the date of your health insurance coverage begins. If you're eligible to add your spouse or your children to your health insurance, then it's time for them to get UP too. As of July 1st, 2008, approval for UP was considered a qualifying event for applicants to enroll in their sponsored health insurance plan at any time. So applicants do not have to wait for the annual open enrollment to enroll if you're approved for UP. So it can expedite that process, and for more information on that, call 888-222. Sorry, I think I did too many twos there. 888-222-2542. What will it cost you? If you're enrolled with UP, you must pay your monthly premium for your employer's health plan or COBRA coverage. You're also responsible for paying co-pays or co-insurance as required by your health plan. In return, UP will reimburse you up to $150 per adult and up to $120 per child. So for example, if a household has one parent and two children, health plan total premium is $400 per month for the whole family. The UP reimbursement would be $150 for one adult plus $240 for 2 children, which would be $390 per month. So your total cost was $10, and then any copays or coinsurance and deductibles. So it just kind of mitigates the premium cost for insurance. The following services now that we're focused on, that was a lot of reading, are offered through Bear Lake Community Health Center. So to apply or to have more information, go to bearlakecommunityhealthcenter.org or visit one of their locations. They're at the Valley. And this is their logo, so you can recognize them. It also might say Cache Valley Community Health Center rather than Bear Lake. Here are all the different locations: Garden City, North Logan, Utah, Evanston, Wyoming, Providence, Utah, Brigham City, Utah, Rock Springs, Wyoming, and Montpelier, Idaho. They provide family medicine services, pharmacy, dental at the North Logan, Garden City, and Montpelier offices, OBGYN clinics, and behavioral health. They also provide financial assistance, so they use a sliding fee scale program. This program is based upon household size and annual income, and the pharmacy offers special pricing for patients of Bear Lake Community Health Centers. So if you'd like to see the brackets for obstetrics and medical, you can visit the website, and dental to see those. Payment options. Patients that have an outstanding balance on their account have 3 different payment options to choose from. First, pay their account in full and receive a discount. Second, make automatic payment arrangements with a credit card or bank account information. Third, make arrangements to call or mail in monthly payments. Appropriate payment arrangements must be made on outstanding balances. The same day discount, if you pay the account in full, you can receive a 10% discount, or pay account on full specified date with no discount. Finance, you can waive finance charges by scheduling automatic monthly payment deductions that can be charged to your credit card, debit card, checking account, or savings account on the day of the month. Any day of the month, excuse me. A minimum of 10% of the outstanding balance must be paid monthly with this arrangement. And a payment plan. You can arrange or a call or mail-in payment plan. Payments must be at least 10% of the outstanding balance and be made by the final day of each month. An additional one-time 18% finance charges placed on the account with this option. Nutritional services include diabetes education, weight loss, meal planning, preparation, and serving education. Specialized diets for preference and medical needs. Specialty classes and groups include smoking cessation, diabetes, obesity, health and wellness, intuitive eating, eating disorder support group, initial fitness assessment, boot camp, behavioral health. And you can call for the dates and pricing of those. Dental services include full-service family dentistry, preventative care, dentures, root canal or endodontics, restorative fillings, crowns and bridges, Invisalign, extractions and oral surgery, teeth whitening, cosmetic procedures, emergencies, and there's a hygienist on site. The mental and behavioral health services include counseling for groups, couples, and individuals, therapy sessions for addictions, depression, anxiety, and all forms of abuse, mental diseases, and eating disorders. The medical and behavioral health slide is here. I'm not going to read through it all, but you can come back and check it out if you are curious about that, or head up to the website. But I will read these little things here. An office visit fee on the day of service will be charged based on the percentage of slide qualified for. Household members include self, spouse, children under 18 years of age, and anyone within the household that the head of household provides monetary support for. For families with 11 or more members, add $4,320 to the annual income level. Starting with the 11th member. Please be advised that these rates are subject to change, and sliding fee services will be provided regardless of patients' ability to pay based on the percentage of slide qualified for, and after an application has been successfully submitted and approved. the dental slide. Wait. So the first stars for supplies and equipment include dentures, crowns, bridges, and then the visit fee may include an evaluation, pro fee, x-rays, fluoride, fillings, most extractions, SRPs, and perio maintenance. And then the visit fee may also include exam, cleaning, and all necessary x-rays. For the health insurance marketplace, the following resources that we will cover are through the marketplace, so you can visit that website at healthcare.gov. Make sure to select your state or zip code. So a quick guide to the health insurance marketplace, 5 tips about the health insurance marketplace. Deadlines for 2020 coverage have passed. But anybody who's eligible for the marketplace must live in the United States, be a U.S. citizen, or national or lawfully present, and not be incarcerated. 2 kinds of coverage. Depending on income, you may qualify for insurance plans with tax credits or for Medicaid and the Children's Insurance Health Program, so CHIP. The plans cover essential health benefits, pre-existing conditions, and preventative services. And their estimated prices and plans based on income are available to view before logging in.